All right, here we go. Morning of surgery. This is the before. I have found that over the years I've probably lifted my eyes some just to open my eyelids a little bit more, but if I totally relax, it's more like this. So today I'm supposed to have this brought up and then some of this puffiness, this part moved and then this part removed. So we will see. All right, I'll let you see the aftermath. All right, here is my day of surgery that night. And as you can see, I look like I have some great makeup on. I really feel fine. I look like I've been in a car wreck, but I really am doing great. Actually, I look like Rocky. Hey, Adrian. Well, I'll check back later with a further update. Also here on the first night, the weirdest thing that I'm seeing is right here in the corner of my eye. It just looks like a really big, gross, dead piece of meat. And it looks like it's still attached, but that's the most troubling thing. It's in the shadow for you, I believe, but it's just a really strange looking thing. So that's something that I'll be monitoring. All right, here I am the day after the surgery. Really still no pain, just very black and blue, but I feel absolutely fine. This is what we're dealing with today. And the PA came by today and said everything was looking pretty good. Okay, here we are, day 3. So my surgery was not yesterday, but the day before yesterday. And I'm getting into what they would consider the peak swelling times. They say about day 3 is about the worst. Still really no pain. It's just, you get an itching sensation. I really look like I've gone through it. The bottoms are just really swollen. The tops are very swollen too, but the bottoms are what's the biggest thing right now, as you can see. Looks like I have 2 plums sitting on my face, but doing good. We'll check back. Hello. Okay, so we are now at day 4. And I woke up this morning feeling a little bit more human. I don't look it really, but I'm starting to feel a little bit better. The biggest surprise that I've had is that my eyes are blurry a lot, but if you read, that's expected. But I guess I was still just surprised at how blurry things are. And I've still been dealing with the itching and so forth. I'm kind of outside the icing window as of today, so I'll probably be just using some cold water to clean it. And the cold water actually feels really good when you just gently start to clean it out, because it gets kind of soupy in there after a while if you don't keep it cleaned out. So anyway, we're making progress, I think. Talk to you later. Hello, here we are at day 5. And you can see I'm starting to bring out more colors of the rainbow. I've got a little bit of the yellow and greenish look going on now. Nothing else much over the last 24 hours or so to report. Still itching. That's probably the most aggravating thing. You'll be amazed at how sensitive your face is to any kind of pressure. I mean, you just touch your face and you can feel the incision line, and you just have to be careful not to put too much pressure on it. But I can open my eyes and I can see, and I'm thankful for that. So we will check back in and see what's happening tomorrow. All right, we've made it to day 6. I think it's looking better. It's looking better, right? Yeah, I think it's looking better. I'll let you know more later. All right, here we are at day 7. If you count the day of surgery as day 1. And the swelling is continuing to go down. I'm starting to get even more interesting colors on my face now. All kinds of interesting hues of yellow and green, and a little bit look like a raccoon. So, but overall, I think things are coming together pretty well. I have had a little more swelling in my right eye. Of course, there's a lot more bruising on that side as well, but it seems to be getting some better too. So I will get my stitches out, I think day after tomorrow. So we'll stay in touch and let you see how it works. Welcome to day 8. Swelling went down, I think, a decent amount overnight. I still have a lot of discoloration, but my eyes are feeling more normal today than they have been, which makes sense. Yeah, so I will keep you posted and let you know what happens again in the next day. Right, bye. All right, here we are at day 9. I got my stitches out today, so that was a big improvement. It helps with itching almost immediately. You can still see that I've got some pretty scary looking stitch marks, but those will fade away. But Doc says I am ahead of the curve as far as healing. You know, typically if you just have the upper done, you're not going to have as much recovery time, but because I had these lowers done too, it's a longer healing period. So if you're just looking at upper, you can expect that you will look a lot better than I do at this stage, most likely. But we're getting there. Well, hello, it's been a few days since I've posted. I am now at the 2-week mark. So you can see that I'm getting better. Certainly not healed, but I'm doing a lot better. So from this standpoint, I'm back at work. Everything's going pretty well. I've had more itching than I think I thought I would, but I'm progressing nicely. And at this point, since there's so little change day to day, I am going to post weekly. So I'll give you a 3-week follow-up here and 1 week from today. Hey everybody, I wanted to check back and let you know that I have now hit my 3-week mark, and other than that right side, things are going particularly well. I mean, I'm doing well anyway, but you know, you're getting a little more color on that side than the other, but it's going pretty good. I'm very pleased with what the doctor has done. You know, if you look carefully, you can still see my scars, and probably will up in the fold of my eye, but you're really not going to see that when my eyes are in their normal position. And then the under eye scars are very, very faint, and I think will continue to fade out as time goes by. But anyway, 3 weeks out, I look a whole lot better than I did, and I will check back in at the 1 month mark, and we'll see how we're doing then. Hello, we are now 4 weeks out from the date of surgery, and I am healing up pretty well. I have, you know, colors on this side, on the right side, a bit, and I do think I probably still have some swelling here under the eyes. I know they're a little bit shiny right now. Even though I'm past the antibiotic stage, I've been putting some Aquaphor on there to keep the scars moist. But doing pretty well, and I think that my main concern right now again is just, you know, I got a bag left here that I don't have as much on that side. It's probably hard to see on the camera, but overall things are going well. You can still see the scars pretty much like you could a week ago, but the under eye scars are getting a lot better. I do think that it's going to come out very nicely, and probably by next week a lot of this should fade. But I will touch base at week 5, and then we'll hopefully see even better progress. Bye-bye. Well, all right, we have made it to week number 5 after surgery, and still a little bit of bruising, but for the most part it's faded out. I've got some bruising here and a little bit here, so it looks a little bit like football player markings. But as you can see, things are coming along pretty well. At this stage, really, my only concern to speak of is I've still got a little more bag here than I do here. And again, that may be difficult to see on the camera. I think I pointed that out maybe a week or 2 ago. Anyway, big improvements since before the surgery, as you can see. So making great progress. I'll just have to see how much change there is in the future to determine whether or not we need to keep doing videos or not. When things stabilize and I'm not really seeing anything worth showing you, we will quit. But this is 5 weeks out. I will go and post again at 6 weeks, and then we'll establish if we need to go further. Thanks for watching. Okay, we are 6 weeks out today. I still have the bruising here and here, which was a little bit unexpected that it would last that long. Otherwise, it's going pretty well. Still, I think have a little bit of swelling here. I went a week ago to the doctor and he said everything was looking fine, and I don't have to go back for approximately 3 months. So I think based on the minor change that has happened in the last week, I think I'm going to go more to a month to month now instead of a week to week, so that hopefully we can show a little more progress. All right, we are 2 months out from surgery, 2 months today, and the residual effects I have would be continued bruising here and here, a little bit bigger bag on here like I mentioned before. There's still actually a little tenderness, but not much. But since I see it every day, I can't tell if there's substantial difference or not from a month ago, but I'll go back and look at the video. But I will post again at month 3. Hello, we are 3 months out of surgery today. So I think this is about the final result. There's still probably a little bit of discoloration, but I don't think we're going to see much change after this. Things are going very well. I've gotten accustomed to the new feel. There is still a little bit of sensitivity. You can tell that in the not so distant past I had something done, but as far as scarring, it's very minimal unless you really get up close and look. But I think it's gone well, and I appreciate you sticking with me. In just the last few days, I hit the 1 year mark, being out from my upper and lower blepharoplasty, and other than me just being a year older, I think the surgery has held and is doing well. I have not had any changes to speak of in many months. The scarring is very minimal. I pointed this out in one of the videos months and months ago, but you can see now that it would be almost impossible to see that I had anything done. A little bit of scarring there right under my eye, it pretty much falls in line with my lashes. But other than getting older, I look very much the same. I'm very pleased with the surgery. And would I do it again, despite looking like I was beat up for several weeks? Yes, I would definitely do it again. If you compare my eyes now to what they were prior to surgery, they don't look nearly as tired. I actually have eyelashes that I haven't been able to see for many years. And for me, it was just a genetic thing. My grandmother had a condition where she had eyes that drooped, as did my father, and then it came straight down to me. And probably one of my children will get it one day. But fortunately, there's something that can take care of it. So I hope you have learned something. If you have any questions, feel free to put them in the comments. If you are looking for the doctor that did this for me in Atlanta, I will certainly put that in the comments if requested. But I think that'll about wrap it up. Thanks for hanging with me. I've never really covered a video like this in any fashion, particularly for a year. So I hope this has helped you a little bit. I know that when I was getting ready to have this done, I was trying to research it, and it's a lot easier sometimes to find videos where ladies have had this done. But speaking to the guys and the ladies out there who wanted to see what it looked like on a fella. So hope you have a great day. Thanks for watching all of this, and take care.